Hello, I'm Dr. Prashant Kamble, a hand, wrist, elbow surgeon with more than 12 years of experience consulting at Sir H.N. Reliance Foundation Hospital, Gurgaon in Mumbai. Today, I'll be discussing carpal tunnel syndrome. What is it? How to recognize the signs and practical tips for managing the condition. My goal is to provide you the expert insight that will help you better understanding your option and make informed decision about your treatment. First, let us understand what is carpal tunnel syndrome. The carpal tunnel is a narrow passageway in your wrist formed by your wrist. It's like a tunnel that allows tendons, ligaments, and nerve pass through your hand. Carpal tunnel syndrome occurs when something irritates our hand of a nerve called the median nerve, which travels through this tunnel. The median nerve controls movement in your forearm and provides sensation to most of your fingers and hands. When this nerve is compressed or irritated within the carpal tunnel, it can cause unusual or heightened sensation in your hand and wrist. Now let us look at what carpal tunnel symptoms are. Common symptoms include itching, burning, pain, or weakness, especially in the thumb, index, and middle finger. Shock-like sensation spreading to your fingers, pain or tingling that may travel up to your forearm to your shoulder. Difficulty holding object due to weakness or numbness. The symptoms usually develop gradually, often starting in one or both hands, night, and then easing during the day. As the condition worsens, symptoms may occur more frequently and last longer, even during the day. Sleeping with bent wrist can worsen nighttime symptoms. During the day, symptoms can occur when holding your wrist in that position for long periods, like when driving or holding a phone. Initially, keeping your hand might help, but as carpal tunnel syndrome progresses, you may lose grip strength, pain, and cramping may increase. This brings us to next question. Who is most at risk to develop carpal tunnel syndrome? Most cases of carpal tunnel syndrome result from combination of factors, with studies showing that women, older adults, more prone to developing the condition. Additionally, risk factors includes genetics likely play a significant role. Some people may naturally have a smaller carpal tunnel, or other anatomical differences that reduces space for the nerve can occur in the families. Repeated hand and wrist motion over time can irritate the tendon in the wrist, leading to swelling that could nerve. Activities involving extreme bending or swelling of the hand and the wrist for the extended period can increase nerve pressure. Changes during pregnancy or swelling that put pressure on the nerve. Conditions like diabetes, rheumatoid arthritis, and thyroid imbalance linked to carpal tunnel syndrome. So, the next natural question would be, how does one can know that one has carpal tunnel syndrome? We diagnose carpal tunnel syndrome by reviewing your medical history, performing your physical examination, and conducting nerve conduction studies. During the physical exam, first you assess your hand, wrist, shoulder, and neck, rule out other potential causes of nerve pressure. I will examine your wrist for tenderness, swelling, or deformity. Check the sensation in your finger and strength of your hand muscle. If needed, I may ask for nerve conduction studies. These are tests that measures the speed of a nerve impulse. If the impulse slows down as they passes into your hand, it may indicate carpal tunnel syndrome. Once you are diagnosed with carpal tunnel syndrome, what are your treatment options? Treatment options offered to you depend on a lot of the age of the condition, your overall health, and a lot of factors. Treatment options may include wearing a splint, help to keep your wrist stable, reducing movement, and elevating nerve compression in the carpal tunnel. These medications either taken orally or injected into carpal tunnel reduce the swelling. Modifying the position of your computer or making other ergonomic changes can help with symptoms. Stretching and strengthening exercise often guided by physiotherapists can be beneficial once symptoms improve. Of course, surgery may be also provided if none of these other treatment help. Surgery for carpal tunnel syndrome is typically outpatient procedure, either done as an open surgery done via endoscopy. So that was all about carpal tunnel syndrome. Dealing with issue that impact your ability to feel and use your hand and finger, and be frightening, bothersome, and frustrating. Carpal tunnel syndrome is no exception. It might be tempting to overlook occasional pain, tingling, or numbness in your hand, especially if these symptoms are intermittent. However, it is important not to ignore that carpal tunnel syndrome can result in permanent nerve damage if not addressed often, but is also highly treatable. I hope this helped you to get some clarity on carpal tunnel syndrome. If you have any concern or queries about carpal tunnel syndrome, feel free to get in touch.